nursing students, before you can begin to understand fluids and electrolytes, ABGs, or really any complication in the body or chronic conditions, there's one thing you have to understand. And I'm about to explain it to you in a way that you are never, ever going to forget. Because I am a professional nursing tutor who specializes in helping you learn to critically think, sometimes by explaining concepts to you like you're a fourth grader, without making you feel dumb. Because if you can't explain concepts in your own words, you're never going to be able to explain them to a frightened, sick patient in the future. And I know that's what you want to do because you are going to be an amazing nurse. Bookmark for later. You need to understand what homeostasis is. I'm sure you've heard the word before, but let's break it down to the root words, and then we're going to talk about it like we're fourth graders. Homeo is like the root word homo, which means same or similar. Stasis means like inactive, static. It's a state of equilibrium. So homeostasis is the body's goal. Your body always wants to try to maintain homeostasis, which is a similar state of equilibrium. Your body's trying to stay the same and run normally, which is why our bodies are so amazingly awesome at compensating when things go wrong, which is good because otherwise we'd die pretty quick. Like you'd get a cut, it wouldn't clot, you're gone. But because of homeostasis, our body can compensate. Even when you get a little cut, it'll clot, you get a scab, you're good to go, it heals. However, because of this, it can make other topics in nursing school a little more difficult to understand. Because basically there's like a gajillion, like seriously, a gajillion different functions operating inside your body, and they all are happening at the same time. It's like seriously enough to make your brain just want to explode. And we can't study things that way. It's so much easier to study topics and concepts in isolation. So like, for example, the 4 most important things in fluids and electrolytes to understand first is osmosis, diffusion, oncotic pressure, and hydrostatic pressure. They all work in tandem with each other. They're like pushing and pulling, affecting the fluid balance in the body. But you can't study them that way. You have to study them in isolation. You have to understand, what does osmosis do? What role does it play? What does diffusion do? What role does it play? And so on. Give me a follow if you want me to teach in more detail on some of these topics, because I'm planning on it and you don't want to miss it. Homeostasis is like driving a car. You put your hands on the steering wheel, and if you want to go straight, you better not hold that steering wheel perfectly straight, because if you do, you're going to crash. Instead, you're constantly making these little micro adjustments, right? Your hands are going up, down just a little bit to adjust the wheels and account for the road and stuff like that. That's what homeostasis does. All of the little pieces and parts of the body, all the little processes that are going on, they're making micro adjustments in relation to one another to keep your body in as close to homeostasis as possible. This helps you understand ABGs, why things can be uncompensated to compensated. And it helps you understand things like first, second, and third spacing. Edema, lots of cardiac symptoms, kidney stuff, urination stuff, basically anything that has to do with water in your body, homeostasis definitely deals with, and pretty much everything else too. So think of homeostasis like the steering wheel of a car, how you're making those micro adjustments, and you should be good to go as you are learning these other concepts and how they all contribute to homeostasis. And if you'd like to work with me more so I can teach you more of these concepts, help you with your clinical judgment, just check my bio link, because all the options to work with me are there.